Hey everyone, welcome to Smart Course, the go-to place for authoritative information and strategies for special needs and learning disorders, especially ADHD. All of the information in this video comes from authoritative sources like Attitude Magazine, Chat.org, and Understood.org. Today, we're going to discuss some of the symptoms of ADHD in teenagers, as well as some tips for parents and teachers who care for a teen with ADHD. First in this video, we're going to talk about some of the symptoms, and then touch on a few things parents and teachers can do to help support the teen they care for and make everything a little more manageable for everyone. In a previous video we did about impulsivity, forgetfulness, and fatigue, we briefly touched on the DSM-5, which is an acronym for the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. For those of you who aren't familiar, the DSM is a tool published by the American Psychiatric Association to educate and assist professionals with diagnosing a wide array of disorders and conditions. In our video, we noted how, as far as ADHD is concerned, a significant change between the 4th and 5th editions is the age at which clinicians began looking for symptoms of ADHD. The 5th edition raised that age from 7 to 12, so right on the cusp of adolescence. This was an important shift because symptoms of ADHD don't always develop in childhood. Many people with ADHD even start experiencing symptoms in adulthood, so while it's still important to recognize and diagnose ADHD as early as possible, the early signs of ADHD are definitely not relegated to childhood. ADHD is typically characterized by inattentive presentations and hyperactive impulsive presentations. Inattentive presentations can look like difficulty maintaining attention with tasks and activities. They don't seem to listen when spoken to, they're reluctant to engage in tasks requiring sustained attention, they experience forgetfulness, and have challenges starting or completing tasks. Hyperactive impulsive presentations can look like fidgeting, challenges with patience, talking excessively, interrupting others, and motivated with reward for any task. This is definitely a limited list, as everyone's experiences with ADHD is unique and presentations can change over time as well. In our impulsivity, forgetfulness, and fatigue video, we also talked about a few of the structural differences between ADHD brains and non-ADHD brains, and how these neurological and structural differences manifest as symptoms of ADHD. The shift from childhood to adolescence is tricky, to say the least. Brains are still changing and developing, even into early adulthood. Being a teen and going through puberty is tough. Bodies change, likes and dislikes change. Self-perception is definitely vulnerable and changing. Teens want more autonomy, and we haven't even mentioned school yet. With middle school friends going off to different high schools, it can be difficult to maintain those relationships on top of trying to form new ones. High school is less structured than middle school, as students are given more independence. The workload is also greater. There's college prep to think about. After a certain age, jobs are now an option. There are more standardized tests and regular assessments, and the list just goes on. For anyone, adolescence is tough, and it's even tougher with ADHD. While teens with ADHD tend to have fewer hyperactive presentations, here are some of the common symptoms of ADHD in teens: distractibility or lack of focus, disorganization and forgetfulness, fidgeting, heightened emotionality or a sensitivity to rejection, impulsivity, trouble completing tasks, and other comorbid conditions like anxiety, autism, or depression. These can look like difficulty starting or completing tasks, emotional control, organization, time management, academic performance, stress management at home, and more. Like I said, ADHD symptoms develop, or at least are more present later in adolescence or adulthood. However, bear in mind, ADHD doesn't suddenly develop in adolescence or any life stage. Symptoms may have been mild or easy to miss in childhood. If your child's ADHD is not diagnosed and supported as early as possible, then understanding and managing their ADHD could be incredibly difficult on top of school and everything else that comes with being a teenager. Here are 3 tips for parents to help the child they care for. First is to start each year, quarter, or semester with a plan. Talk to your teen about what to expect, what kind of support they might need, and determine if an IEP will be necessary. Second, to help mitigate challenges at home, let your child have a say in some of the rules. Checking in regularly to air out grievances, acknowledge what is working well, and letting your child have some input in rules helps keep things realistic and ensures that everyone's on the same page. Know which rules and issues are non-negotiable and have preset rewards and consequences. Third, Don't punish your child for something more than once. Sure, what teens do can sometimes be infuriating and have long-lasting effects. However, the same can be said for parents. If your child was already disciplined by you, a teacher, or another authority figure, and you're prepared to punish them again, consider whether or not another consequence from you will help your child learn or add to the friction. Now, here are 3 tips for teachers who work with students who have ADHD. First, when giving instructions or assignments, write them down and announce them to the class. Make sure your students write them down as well. Make sure the instructions are simple, but still clearly outline what you expect from your students. Second, offer alternative assessments. A test is not the only way someone can demonstrate how well they understand a subject or concept. Video presentations, posters, and oral presentations are just some suggestions. Maybe you can even allot a certain amount of time for the students to teach the class. Even accommodations for students with ADHD can go miles, like extended time, a designated quiet area, or adjusting seating to reduce distractions. Third, have a non-verbal signal between you and your students to indicate when a break is needed. For example, a sticky note on the desk or a thumbs up can be a student's way of letting you know they need to move around, they need a break, they're frustrated, or maybe they are too distracted. Something as seemingly simple as a nonverbal signal shows the student that you care and are there to support them. In our upcoming video, we will be learning more about social-emotional learning. For an expert-curated list of resources from our past summit and videos, please visit the link in the description. And if you liked this video, please don't forget to like it and let us know what you liked or what you'd like to see more of in the comments below. Also, don't forget to subscribe and hit the notification bell. The more people that like, subscribe, click the bell, and comment, the more people will see this kind of content on YouTube. And we know some people could really use the help. So also, don't forget to share this with someone you know who could benefit from this video. We share tons of expert-vetted resources on parenting and education for differently abled kids, so feel free to sign up for our newsletter by using the link in the description below. And if you like, subscribe, hit the bell, comment, and sign up for our upcoming summit at this link, we will pin your comment to the top and we will send you our expert-curated list of ADHD resources. If you haven't watched our previous series about ADHD and other disorders, click the annotations to watch those videos. And if you want to support Smart Course and make sure we can continue bringing you content, check out our Kickstarter and membership pages. We also have an online course with even more specific information, step-by-step guides, and access to professionals who can help you through the process. And as always, I appreciate you taking the time. Thank you for watching, and we'll see you soon.